here. Welcome to our first Healthy Aging webinar of the year. This is where we're going to dig into really understanding and being able to prevent falls by using the principles of Tai Chi, using Tai Chi, not Chi walking in winter weather necessarily, but using Tai Chi to help you be more stable. I'm Dianne Bailey. I'm the creator of the Open the Door to Tai Chi system. And we focus on making Tai Chi accessible to everyone so that we can all benefit from this wonderful form of exercise. My guest today is Chris Cinnamon. He's the owner, head instructor at Chicago Tai Chi, which someday I hope to be able to visit. It looks like a beautiful facility, Chris, and I really would love to visit.
We look forward to having you.
Well, thank you. Thank you. He is the author of Tai Chi for Knee Health. We had him on a webinar last year for Tai Chi for Knee Health. It's a great book. If you don't have this, I would recommend you getting it. He's also working on his second book now, Tai Chi for Balance. And that's really where we're going to be focusing today, is how, why are we worried about falls, but then how can we make ourselves and our clients more stable? So Chris, I'm going to let you take it away.
All right. Thank you, Dianne. So I would like to start with a brief exercise. So I'm going to switch the camera, get in my seat. And those of you in the audience, I encourage you to grab a seat, sit comfortably. Dianne, do you see the chair?
I do.
And can you see my feet?
Just barely. Sit back. There you go. That's it.
Okay.
Good. Yeah.
So sit comfortably. Settle in. And now I'd like you to get your mind, your awareness, as far away from your head as you can and still be in your body. So where would that be? Your feet. Feel them. You can wiggle your toes, move them around, feel your feet. Now our feet are richly innervated, meaning they have a lot of nerves and you can get a lot of information from your feet when you tune into it. So what can you feel in your feet? Temperature. Yeah, we certainly feel temperature when our feet are cold. You can feel in this position a little pressure where your feet contact the floor. What else can you feel? You might feel the sensation of your footwear, your socks. And then there's another important sensation your feet will make available to you. Using your proprioception without looking, you can feel where your feet are. And proprioception is an internal sense we all have. And now you can move your feet a little bit, and you can feel that they're in a different position without looking at them. And that's your proprioception. And then move your feet more or less back under your knees and feel them. Feels different than when they're in another position. And then one other set of sensations I encourage you to tune into. Now just slide your feet a little bit. And you can gather information about the surface under your feet. It's texture. So if you're on carpet, it's going to feel different than if you're on linoleum. And part of that texture is a degree of friction between your feet and the surface. So just feel that. So we'll be coming back to this in a minute, but just as a warm-up, I wanted you to take a little time and get your mind in your feet. Now, one more part of the exercise. Stand up. Now feel your feet. They feel different. What feels different? There's more pressure on them. You put more of your weight, all of your weight, on your feet. And you can feel that. It feels different then. Let's sit back down. When you're seated, less pressure. Just another aspect of the sensations that your feet make available to you when you tune into it. All right, I'm going to switch positions. Diane, do you see my webcam now?
Yes, you were looking
Okay.
at you.
All right, now I'm going to share screens, and we're going to begin a presentation about falls risks. And one of the reasons I want to share this information with you is that the research into falls risks in older adults includes this conclusion. Many older adults are not aware of the increased risk of falls. It's like when we didn't know that smoking tended to cause cancer and cardiovascular disease. You didn't know, so you couldn't manage the risk. Or when we didn't know that seat belts decrease the risk of injury in a car accident. If you didn't know, you didn't put your belt on. But knowledge is power, and knowledge is motivation to make behavior adjustments, behavior changes to manage risks. So that's one of the reasons I want to share this with you. Diane, do you have the full screen?
Yes, now we do. That looks good.
Right. Thanks. So let's begin with the data on falls risk in older adults. Annually in the US, 1 in 3 older adults falls. So if we've got 100 people on this, then 33 of them, according to the statistics, are going to fall this year. In the aggregate, that's nearly 30 million falls, 3 million ER visits, 800,000 hospital admissions, 28,000 deaths, and over 50 billion in medical costs associated with falls. And I just invite you to let that sink in for a minute. And when it does, it's not surprising that every leading medical authority, every authority on healthy aging, identifies falls as a major risk for the health of older adults. And the data sure bears that out. There's more. Falling, once you pass 65, falling is the #1 cause of injury and death from injury. In the aggregate in society, the #1 cause of injury is between car accidents and drug overdose. But once you hit 60, that begins to change, and the risk of injury and death from injury from falls begins to increase. And once you pass 65, then it's the #1. 1 out of 5 falls causes a serious injury. And here's what happens. Any of these, particularly when we're over 65, can be a major medical concern. Broken bones, head injuries, broken hips. And the data on broken hips is pretty grim, but I'll share it with you. 90% of broken hips are associated with falls. 40% of those that break a hip do not return to functional walking again. 20% die within a year. So that's a broken hip. If you're into healthy aging, a broken hip is not what you want to do. Some other consequences of falls. Falling leads to a loss of independence. And all of us aim to age and remain independent as long as we can. Falling is a major factor. 40% of assisted living facility admissions are associated with falling. And there's a host of other physical, psychological, and social consequences. And you can see these here. Once a person falls, they tend to be less active. They tend to get out less. Their mobility decreases, reduced social contact. And then there's psychological consequences, fear, depression. And there's a designated psychological syndrome, post-fall anxiety syndrome, where people tend to be anxious about going out and tending to stay in less and move less. Now, there's a lot of risk factors for falls. On the screen is a few of them. The #1, loss of leg and hip strength. So if you can do an exercise that helps strengthen your legs and hips, you're going after the #1 risk factor for falls. And you can see the others here. Let me point out a couple. Gender. Women are much more likely to go to the hospital after a fall than men. And part of that could be due to decreased bone density, more brittle bones from osteoporosis. But that's what the data indicates. And then multiple medications. As we age, people become more susceptible to chronic diseases and tend to take an increasing amount of medication. The data suggests that falls risk increase significantly for those that are on 4 or more medications. So this is not to scare. This is to inform. You know, when we start checking off the list of risk factors and we start to get some more checks here, then hey, that can be helpful information to motivate behavior change to do something about the falls risk. So that's the risks. And one way to characterize what I just shared with you is it's bad news. Right? The data on falling, much of it is grim. But I'm not here to dwell on the bad news. I want to turn to the good news. Falls are not an inevitable result of aging. Prevention interventions reduce falls. And those are not my words. Those are the government's words. That comes right from the CDC. But not just the CDC. And we'll get to that in a moment. What does the CDC advise about managing fall risk? Do exercises that make your legs strong and improve your balance. And what exercise does the government recommend? Tai Chi. But not just the CDC. Now you've got the logos of some major authorities on healthy aging, on medicine in the US, and they all agree. Tai Chi is the best exercise for balance. And that comes right from Harvard Medical School. And you'll find similar statements from the Mayo Clinic, from the American College of Sports Medicine, from the National Council on Aging. So why do these leading medical authorities recommend Tai Chi? Because of the science. On your screen right now are the titles of just a handful of the many research articles reporting on studies concluding that Tai Chi is effective in reducing falls in older adults. I want to get into one important study in a little more detail. And this was reported in the Journal of the American Medical Association, a prestigious scientific journal, at the end of 2018. And the study involved approximately 700 people that were older adults. So the mean age was 78. And then they were randomly assigned to 3 groups. So this was a random comparative trial that wanted to test 3 different exercise interventions and evaluate the comparative effects on falls in this group. There were 3 groups: a Tai Chi group, a multimodal exercise group, and that's a combination of resistance training, aerobic training, stretching that you might get at a senior center, and then there was a stretching only group. And they stuck with these interventions for an extended period. So this was a 6-month test, twice a week, 60-minute classes twice a week, led by trained instructors. And here's what happened. After 6 months, the Tai Chi group had experienced significantly fewer falls than either of the other groups. Compared to the stretching group, almost half the number of falls in the Tai Chi group, and a third fewer falls in the multimodal exercise group. So this is a more detailed example of why the medical authorities and research conclude that Tai Chi is an effective intervention for reducing falls in older adults. So just to recap, so that no one that's in this audience now and no one that views this is going to be in that group that doesn't understand falls. So the big points: falls are a serious health risk for us as we age, but they are not inevitable as we age. Falls are preventable. The main intervention for reducing falls is exercise, and the #1 recommended exercise for reducing falls, Tai Chi. So with that, let's get into some exercises. And let's see. And Diane, do you have my screen back?
Yep, we're looking at you.
Okay, so let me switch.
There you go. There's the chair. I see it.
Got it. So at Chicago Tai Chi, I lead a program that I developed that we call Tai Chi for Balance. And I began to do that 5 years ago as an increasing number of people came to me and expressed a concern about balance and fall. And I've got a master's in kinesiology, and part of what the research I got into in that program was Tai Chi as an intervention for falls prevention. So I developed a program that uses a simplified Tai Chi movement set. So it's easier to learn than a full Tai Chi form, but it includes the key elements of Tai Chi that contribute most directly to improving stability and balance. So and what I'm about to share with you comes out of that program. So to begin, let us get up. And while we talk about balance, and we talk about good balance or bad balance, and the need to improve balance, I'm gonna stake out a position that may be a little controversial. But I think falls prevention in older adults is less about improving balance and more about improving stability. Less about balance, more about stability. Now, what do I mean by that? So balance is generally defined as a state of equilibrium. All right. So let's say I was doing the Wu style long form and I did a move like this. Now here I need some balance. I need some equilibrium here. This is called white crane, stands on one leg. Beautiful move, but it's not very practical. You know, you don't do that walking down the street. And most people doing white crane, stands on one leg, are not falling. But most falls occur when we're ambulating, when we're walking around. And in that case, stability is much more important. So what do I mean by stability? Stability, out of mechanics and biomechanics, is the quality of an object to return to equilibrium after being displaced. So it's not being in a state of equilibrium, it's the ability to return to equilibrium after being out of equilibrium. So let's feel that a little bit. So let's stand up. Stand comfortably, get your feet more or less on your hips. Get a more or less upright vertical posture, relaxed. And then again, get your mind as far out of your head as you can, into your feet, and feel your feet. One of the objectives of my Tai Chi for Balance program is to develop increasing whole body awareness, which is a fundamental in Tai Chi as well, because for a variety of reasons in Tai Chi. But in Tai Chi for Balance, it's particularly important. Because if you talk to most people after a fall, one thing you will hear is, I was walking along and then all of a sudden, I was flying and then hit the ground. And underneath that is their mind was somewhere else than in their body. And to train yourself to keep your mind and your body with increasing consistency, particularly in a few parts of your body we're going to talk about, is a key to beginning to prevent a fall. So drop your mind on your feet and feel them. And feel. If you're standing up and you're not wobbling around, then you're pretty stable. Now let's displace ourselves a little bit. So just lean over to one side. And now bring yourself back to the center. And again, lean a little bit over to the other side. Not too much, just a little. And then bring yourself back to the center. So in this position, in this exercise, you're more or less stable. I want to get into some details about stability. Now, stability involves a few, what we'll call technical terms. We can draw them out of biomechanics. So the first is base of support. Base of support. And base of support is defined as the area underneath where you contact the ground. So my base of support right now is right here. And so is yours. And then another key concept in stability is center of mass or center of gravity. And center of gravity is defined as the point in an object, including a human object, through which gravity acts. And in a human, it's really the sum of the center of gravity of all the parts. And I've done those calculations. But for our purposes, in this position right now, your center of gravity is more or less here in the center of your body. Not surprisingly, located around what the Taoists would call the lower dantian. So we're here. But in a human, because humans move and we've got moving parts, moving a part of you off this posture will move your center of gravity a little bit to that side because we're moving some of our mass over there. And then we bring it back, then our center of gravity comes more into the center. Now, an object is more stable when its center of gravity is within the center of the base of the support. More stable when the center of mass is toward the center of the base of support. Conversely, an object is less stable when its center of mass is toward the edge of the base of support. Let's try that out. So now just begin to lean to one side. And what's happening is more of your mass is going over in this direction, so more of your center mass is going in here, over to this side. And you can feel that. Now, don't destabilize yourself, but you can get to a point where if, you got a little bit of a push from this side, whoa, you'd go over if you didn't move your base of support, if you didn't return to equilibrium. Let's try it the other way. So just begin to move a little of your mass over here, so you're getting closer and closer to the edge of your base of support. And here, you'll feel less stable than here. So another way to work with these concepts, to increase an object's stability, there's a few variables you can play with. One is to widen the base of support. So let's do that. Take a wider stance. Now, lean a little more to one side. And feel in your body, do you feel the same, like you'd get pulled over, you get tipped over if you got some pressure on this side, and maybe not. So now return to the center. Shift over to the other side and feel. Do you feel more stable than you did when you were here? And then return to the center. Now, another way to increase the stability of an object is to lower its center of mass. So let's try that. So just squat down a little, just keep it comfortable, but just lower yourself a little. Now, feel, do you feel more or less stable as you put weight from one side to another? So now widen your stance a little bit more and feel that. So let's add the arms to it. Now do this. And what do we have here? We're like a pyramid, very stable. Now in contrast, let's bring, now our base of support is small, and just lean a little bit. More or less stable? At least in my body, it feels less stable. More like the Leaning Tower of Pisa than a Mayan pyramid, right? So a couple ideas out of biomechanics that then apply to how we can adjust our position, our posture, our stance to increase stability rather than reduce it. So I'd like to do an exercise right now. So just take a comfortable stance. And then begin to lean a little. And when you feel, I'm starting to get unstable, then widen your stance and sink. And see how that feels. Again. Lean a little, lean a little. Oh, when you start to feel unstable, widen your stance and sink. Let's try it to the other side. Lean a little, and when you get a sense you're becoming less stable, widen your stance and sink. And that is a practical strategy for when you feel unstable. The problem is, instability also has an emotional component to it. When we feel like we're going to fall, what happens? Anxiety, fear. And what happens when we become anxious and fear? Our energy comes up. It's more like this. Watch. Don't follow me through this. Just watch this. Right? And what am I doing? I am raising my center of mass. I'm becoming less stable. And that can be a natural reaction. And to change natural reactions takes training. And one of the exercises out of my Tai Chi for Balance program is just what we're doing here. Sink when you feel unstable. Sink. And over time, you reprogram your nervous system, and that becomes a natural reaction. So when you feel instability, instead of becoming more unstable, you become more stable. So one approach to dealing with instability is to adjust the variables that make you more stable. So what I'd like to do next is a movement exercise. And it's very functional. It's right out of Tai Chi, but it's right out of life. One movement component we do all the time in Tai Chi is shift weight. And one movement component we do in every step we take is a full weight shift. So I'm going to ask you to put a leg forward. Put your weight on it. And just put your hands on your belly. And then begin to smoothly shift weight back. Smoothly shift weight forward. Smoothly shift weight back. Smoothly shift weight forward. And just begin to do that. Feel your feet. What's going on? If you are smoothly shifting weight from one leg to another and you're feeling your feet, you're feeling the pressure in your feet constantly change. Remember when we were seated, we felt static pressure of some amount in our feet. And then when we stood up, we felt static pressure of an increased amount. But now that pressure is dynamic and you can feel it. Shift weight back. Change your stance, please. Shift weight forward. Shift weight back. Shift weight forward. Shift weight back. Now, if you are smoothly, slowly, and completely shifting weight back and forth, which you do all the time in Tai Chi, one thing that's happening, you're doing muscular work. When you load up a leg, feel the muscles engage, the muscles in the legs and the hips. Then they relax as you load up the other leg, and then the muscles in the other leg engage. And that muscular work results in time over toning the muscles. They get stronger. But a wonderful characteristic about strength training in Tai Chi, if you will, is you're not pounding your joints. And particularly for those of us that have been on the planet for sufficient decades and done enough high impact activity that our joints will benefit from not being pounded, this is a very effective way to strengthen the legs. All right, now if you just stand again, so we felt our feet. Now I would like you to extend your awareness to another important part of you in Tai Chi for balance. It's what I call our center. And we'll define our center by, so here's the top of my head, we call it the crown point. And if you drop your mind straight through the middle of you to the bottom of your pelvis, you get to the perineum. And all that tissue along that line is innervated, so you can feel it. So just take a moment, starting at the top of your head, and feel down your center until you get your mind in your center. And feel it. And among the sensations you can discern when you feel your center is its orientation to the ground, to the floor. And in Tai Chi for balance, we're aiming to have a vertical center. So it's perpendicular to the floor, unless for a particular reason we're inclining it intentionally. But when we're not intentionally inclining it, we want it vertical. So now feel your center and just tilt it to one side a little. And then bring it back to the vertical. Feels different, doesn't it? Go the other side, tilt it. Feel that. It feels different than when it's vertical. And I'm moving my center just a few degrees, and I encourage you to keep it small as well, but it feels different. Now, let's go forward just a little. And feel, does that feel different than when you're vertical? And just lean back just a little. Does that feel different? And bring it back to the center. So now we take that exercise to our discussion of stability, and how can we put that together with how to increase stability or decrease stability? And it's this: when we're leaning, when our center's off the vertical, our center of mass is closer to the edge of our base of support, and we are less stable. When our center is vertical and we are centered over our base of support, we are more stable. So in Tai Chi for balance, a big principle is developing whole body awareness. So you feel your feet and you feel your center. And then you use that to develop increasingly precise posture control. I want to go back to the weight shift now. I'm going to rotate 90 degrees, and you can face me and do this. It's highly likely that for people in the audience that haven't had training, that this is what's happening when you shift weight. You're leaning. And there's nothing wrong with that. I mean, the body does that, you're fine, except when you're trying to develop an increasingly stable structure, then that becomes problematic. When you're in increased risk for falling, a tendency to lean as you move means you're creating a less stable structure. So Let's go back to the weight shift. Now I'm going to turn 90 degrees. You face the screen. Put a foot forward. Shift your weight back. Place your hands on your belly. Now shift weight forward and pause. Feel your center. What's its relationship to the floor? Is it tilted a little bit? And you can feel when it is. And if it is, that's fine. Just correct. Now shift weight back. Feel your center. Did you lead with your head a little bit? Very common. Nothing wrong with it, but you're less stable. So come back to the vertical. And now let's smoothly shift weight from one leg to another. Now feeling our center. Now our center is moving through space, but is it moving off the vertical? When you feel your center, you can discern that and correct it. And this is an exercise right out of my Tai Chi for Balance program. And most people that start the program do not stay vertical when they shift weight. By the end of the program, they are rock solid stable in the vertical. Change your stance, please. Shift weight back. Feel your center. Keep it vertical. Shift weight forward. Feel your center. Either maintain it in the vertical or correct. And you can feel when you lead with your head and correct it. All right. So let's follow the progression, increase the degree of difficulty a little bit. I'll face you for this one, put a foot forward. Shift weight back, feel your feet. Shift weight forward, feel the pressure change. Shift weight back, feel the pressure change. Now, feel your feet and your center. So now you have to expand your awareness to more of you. And for most of us, at the start, we're not used to doing that. We're used to moving around with our mind somewhere else, jumping around to where we're going or whatever's on our mind that's not what we're doing right now. And it takes training to develop both more consistent presence and whole body awareness to be able to feel your feet and your center. Switch your stance, please. Feel your feet. Feel your center. And if you find your mind jumps off somewhere, that's okay. Our minds do that. Just bring it back. Feel your feet. Feel your center. And feel the degree of stability you experience as you shift weight and maintain a vertical posture. Very good. So we train that in Tai Chi for Balance, and then it becomes very functionally applicable to walking around. As we develop the ability to walk as infants and toddlers, we concentrate a lot on it. But after that, walking becomes pre-conscious. You just think where you want to go and you walk there, which is fine until you get at an increased risk of falling. And my recommendation is for those of us that are approaching or in the higher risk zone, that you begin to pay more attention to your walking. And by getting your mind in your feet, by feeling your set. Now, by getting your mind and your feet, you're going to gather a lot of information, including things that can trip you, things that can slip you up. And by having increasingly consistent awareness in your feet, you're going to feel that stuff sooner and be able to react to it, rather than not feel it and fall. And the same with maintaining a more vertical posture. Instead of having that less stable, and every perturbation off the vertical makes your structure less stable, you develop more awareness and more precise posture control to maintain a more stable structure. So I'd like to wrap with one more exercise. We call this Tai Chi Walking, and it comes a little later in the program, but you'll all do fine. And it takes the principles we develop in the movement set that does not, you take a stance, but you're not stepping, and then takes it into stepping. So I want to demonstrate. Excuse me. So the Tai Chi walking exercise goes like this. So I have my weight forward, and note, I'm organizing my posture more or less vertically. My weight's forward, and I feel my weight here. And then I feel my unweighted foot, and I lift the heel. And I stabilize here. I still have 2 contact points. And then when I'm ready, I slowly take a step, and I land this heel lightly. Then I shift weight. Heel comes up. Step slowly, land lightly, then shift weight. And that's very different than normal gait. Normal gait, and I studied it in gait analysis lab, goes like this. So I'm going to slow it down. So you begin to move the body forward and swing the leg forward. And note my center of mass is moving forward, and to avoid a fall, I swung my leg forward. I moved my base of support, and it's the same. In clinical gait analysis, one way we describe walking is a controlled fall, because you're falling forward and you catch it with the leg you swing forward, and that works until something catches a leg or you slip, and then you go down. And as we age, as we seek healthy aging, one takeaway I hope you all have is that we want to avoid those unintended trips to the ground. So let's do some Tai Chi walking together. I will, for starters, I'll be at the profile view. You can walk toward the screen so you can step back and give yourself a few steps. So we start out like so. You can have your arms comfortably at your sides, a little wider out, so like a tightrope walker. And then weights forward, posture's vertical. Then the heel comes up, and just stabilize here. And take a step, small step's fine. Land the heel lightly. So note, no weight on this yet. Then shift weight. Vertical posture, stable over the front leg. Back heel comes up. Step, land lightly, then shift weight. Back heel comes up. Step, land lightly, then shift weight. So that's a demonstration of Tai Chi walking. Now for anyone that feels unstable doing that, then make an adjustment. For example, you can just lightly touch a wall or a counter, so you have an extra contact point, and do the exercise like that. Both in classes and in private instruction, I work with some people with some significant neurological impairments, and we'll work out accommodations like that. So if anyone in the audience either has that situation or works with people with that situation, that's one way to adjust it. So Diane, I believe we're coming up to the Q&A time. Am I correct?
We are. This has been wonderful. Do you have any other exercises to show us, or do you want to start taking questions?
You know, but one other point about this Tai Chi walking, particularly, you know, if you do it for 5 or 10 minutes, it is muscular work. I've tested this in the gait analysis lab, and I'll tell you. So what's going on here is this base leg is exercising. In normal walk, what happens, the amount, the time during which this leg is supporting the body weight is very limited. And I'll tell you how much in just a second. So it's just working less. And that's okay for long distance walking. You want it to be efficient. But when you want to build your legs, with strong legs and hips, then slow it down. And that's harder. And your legs will respond and get stronger. And just to quantify that, I did an experiment in the gait analysis lab that measured, among other things, how long it took to fully load a leg in normal gait and how long it took to fully load a leg in a version of this in brush knees, in Wu style brush knees. And in normal gait, the mean time to fully load the leg as I walked was a quarter second. So it's like heel hits, boom, quarter second later, all my weight's on that leg, and then it's onto the other leg. In Wu style brush knees, it went like this. 1, 2, 3, 4, 5, 6, 7, 8. 8 seconds. And that was consistent across several trials. And an example of the increased muscular work that happens when you do these exercises. And again, the muscles respond and they tone and get stronger. So with that, Dianne, let me come back over to the screen and glad to help with the Q&A.
Awesome. Thank you so much. And as you were talking about that, all of the benefits, it occurred to me that, and it's something that I talk about a lot, in that you can't just do one exercise or do one class or do one, take a balance class that you just attend one time. You have to consistently practice to change your body's behavior, to change your body's natural reaction. As you talked about a natural reaction, actually raising your center of mass, we have to train to have our body respond in a different way. And that's part of the beauty of Tai Chi, is that it is a consistent practice. It encourages people to practice and encourage them to gain that whole body awareness. That was another point that I really enjoyed that you said, that we walk around a lot with our heads somewhere else and we're not body aware. Whereas Tai Chi, in your practice of Tai Chi, is actually training your mind, training you to be mindful in your movement. It is movement meditation, but it's also training you just to be aware of, where is my body? How is it responding? What can I change to make myself more stable? I really appreciated that. It was very, very good, Chris.
You're welcome. I'm steeped in this, and I want to communicate this clear to everybody on this audience. I don't want you to fall. I want you to enjoy your life without the life-altering consequences of fall injuries. And Dianne, just for those that are interested in more, give me just a moment. Let me show you. I want to share my screen. And for those that are, hang on a second. For those of you that are interested in more of this kind of training that I make available, just want to show you where to go. So this is the Chicago Tai Chi website, www.chicagotaichi.org. And then when you, on the menu, you'll see Tai Chi for Balance. And you'll see 2 courses. One is Tai Chi for Balance Online. And that is that's a program that'll lead you through the whole syllabus of Tai Chi for Balance that I teach. You can get to this page, scroll down, and get all the information. And then for those of us that are in northern latitudes, we offer a shorter course that's a lot of fun, but very practical. We call it Strategies for Winter Walking. And it takes elements of Tai Chi for Balance, exercises out of Tai Chi for Balance, and applies it specifically to dealing with slippery walking surfaces. And if that's of interest, you can go to this page and you'll learn more about that course.
Awesome.
All right.
Thank you, Chris. We had a couple questions about maybe potential clients that have differing issues. One being MS. Is Tai Chi good for MS? And I've already answered that. Yes, it is, but I wanted to hear your take on it. But I also there's another question about adapting for students with neuropathy.
Yeah, and I've got substantial experience in both. MS is really tricky. The symptoms are highly variable from mild to severe. Research suggests that Tai Chi can help manage MS symptoms and can have an MS can give an activity to an MS patient that gets them moving and works on leg strength, body awareness, and stability. The one aspect of working with an MS patient is you got to deal with where they are that day and absolutely adjust the routine. That said, one of my MS clients, I did some data collection, and it was heartwarming and really, really fascinating to watch this develop. When we started, I measured the duration between breaks, and initially the mean duration was about 7 minutes, and she'd have to take a break. And then the aggregate exercise time would be, in an hour, would be somewhere around 30 minutes. And after 4 months, she could hang in there for 30 minutes sometimes and get up to 50 minutes for a session.
That's awesome.
And yeah, and it was gradual and it was variable, but it was evidence, at least in her case, that Tai Chi was an effective exercise to increase her activity. And she liked it.
And that's a big piece of the puzzle too, is it is an activity that people will return to because it is enjoyable. So it comes back to practicing that. So what about neuropathy? Chris, do you have any thoughts on clients with neuropathy?
Yeah, I recently led a Qigong intervention. It was a study at Northwestern University Medical School, working for this wonderful neurologist, Jenny Tabby, who since moved out to Denver.
Oh,
and heads there's a Jewish hospital there.
National Jewish.
National Jewish, all right. And she's the lead of their neurology department.
Awesome.
And the last time out there, when I visited you, I visited her too, Jenny Tabby. Anyway, she wanted to test a Qigong intervention for diabetic neuropathy patients. So I led them through, it was eight weeks of 8 brocades.
Mhm.
And it was a pilot, but they all loved it and responded well, and were able to do the exercises without aggravating the symptoms.
Nice.
And Tai Chi for Balance, as I teach it, is similarly adaptable to people that have those kind of conditions. Gets them on their feet, moving in ways that don't aggravate the neuropathy, and with the potential of ameliorating it to some degree.
Great.
In any specific case, you don't know, but you can test it and evaluate it. And if the response is positive, then you're onto something.
Have another question that Nancy talks about. How do you help clients that come in with their posture is already very poor? The forward head thing is really ingrained into their position just from the beginning. Is there anything that you do to help with that?
Yeah, for starters, I don't use the word poor. Their posture is less vertical. And the aim is to help them have a more vertical posture. How you get there depends on where they started. And the standing posture I teach has specific alignments, and I mean nothing unconventional about it. But to get those alignments in place, depending on where a person starts, there may be very small adjustments that get them a little more vertical. And then if they stick with it, then the tissue that is tightened over time, in the head for it, maybe they begin to get a little more length. And you can get the head back. You might be able to open up the spine a little more. And then again, depending on what they have going on, there's specific practices, including types of Qigong, that may be more effective than just doing a Tai Chi form and beginning to open up areas that have closed down. So generally, I'd say, yeah, it's definitely worth working with them. And I think more specifically, you got to look at the case.
Right. And I think too that visualization in Tai Chi, the visualization of being suspended from the crown of your head, allowing your body to fall naturally into alignment, know that it's not going to magically correct that forward head. It's not going to magically correct the forward lean. But if they can start to visualize themselves as being in that vertical position, that helps. The mind is very strong. It wants to come into that position. So there's a couple other questions of, one is, how often should you do Tai Chi to see results? Quantify that?
Yeah, the research suggests there is a dose response effect. So that means the more you do to a degree without overdoing it, the more improvement you'll experience within a given time frame. Generally, well, Tai Chi for Balance, so the class is once a week, and I recommend people practice 15 minutes a day, 5 days a week. If they can work that in, it doesn't burden their schedule too much, and it helps get the material in, and then the weight shifting exercises, the stepping exercise will begin to strengthen the legs. And generally, the research and my experiences, if they're practicing pretty consistently, you'll start seeing change in 2 to 3 months. And by change, I mean increased stability that they feel. And they say, Chris, I'm feeling more stable.
Yep.
And I said, well, that's a positive response.
That's right. That's what we want. Right. Jacqueline, you had asked about Tai Chi versus Qigong. And that's a very long discussion that we can shorten it into a very simple Violet Lee says it in a way that I think is very beautiful. Qigong is the tree and Tai Chi is a branch. Tai Chi is a Qigong. It's also a martial art. All of Qigong is not necessarily martial art. Qigong is healing arts, and Tai Chi is a branch of that tree. Let's see. Jay wants to know when your book's coming out.
So I'm aiming to have it out by the end of the year.
Awesome.
Yeah, and it's moving along steadily.
Okay, let me see. Agnes has a few questions about let's see. When you're talking about sinking and widening your stance to prevent falling, is this for pre-fall? But does it actually work when you're falling? And the quickness of how you have to respond to falling.
So first, the quickness you have to respond to falling often is because the faller has not been their mind has not been where they are, and
Right.
Definitely not in their feet, definitely not in their posture. So it's like they bring this less stable structure into a slip or a trip, and then that's all it takes. With training, and my strategies for when walking course is really good for this. You know, I'll walk around and I'll look for slippery stuff now because I feel it. I mean, my mind is consistently in my feet. I'm feeling the texture of the walking surface, and I'm making small adjustments to my gait, how I walk, my step length to maintain stability. I mean, I can walk across an ice rink, and anyone here can too.
Sure.
When you walk in a way that does not require friction. And I get into that in the course. You know, I mean, and friction is what makes you slip, and then an obstruction trips you. And by having your mind and your feet, you can feel that. And then another piece of Agnes' question, this lowering of yourself when you feel unstable also has this other benefit. If you end up falling, you're closer to the ground and your mass will accelerate less, so the force of impact will be less.
That's awesome.
Yeah.
Right? Yeah. So with all of the programs that you have, one of the other questions was, you know, do you have an actual physical studio? Yes, that's where you are right now.
In the heart of the Chicago Loop.
And yes, I do as well. I'm in Centennial, Colorado, on the southern edge of the Denver metro area. We both have.
Dianne?
Yes.
And I love your space. I visited the last time I was out there, and it's a lovely facility.
Thank you. Thank you. I appreciate that. And I do want to encourage everybody in here that, you know, if you can find a class, obviously, if you're in Chicago area, go see Chris. If you're in the Denver area, go see me, come see me. But if you don't have those two locations, there are other instructors. There's Open the Door to Tai Chi instructors all over the country, really all over the world. Try to find a class. That's a good thing to keep yourself practicing. Obviously, Chris has the two programs that he's been talking about, that they're online. You can get those anywhere. Open the Door also has an online video membership that you can learn some basic Tai Chi. You can learn some balance form. You can learn for more traditional, the Yang style of Tai Chi. And that video membership site, that's on taichisystem.com. It's a singular, taichisystem.com. So there are lots of options for you. You know, you don't just say this was great, I love this, and then forget about it. You know, take steps. Do Chris's program. Sign up for the video membership. Start to incorporate Tai Chi into your regular life. Like Chris was saying, you can do Tai Chi 15 minutes a day. everybody's got 15 minutes to carve out of their day. And it's such a gentle exercise. It's so good for you in not only in helping your balance, but in lots of other ways as well. So I do encourage you to participate in Tai Chi in as many different ways as you can. We're going to get going because it is the top of the hour. I really appreciate you, Chris, that you were able to put this together for us with all the research that you're doing for the book, that you could share this with us and to really demonstrate that Tai Chi is an amazing form of exercise that will help us as we age and help us be more stable. That's really important delineation, is that being stable, being a stable human being in your movement. So thank you so much for this presentation. I hope everybody has a great day. Go enjoy the snow, be safe, and be aware of your body and of your movement.
And start doing the practices that will help you avoid those unintended trips to the ground.
Right.
And that will be a key to healthy aging.
That's right. Thank you, everybody. You have a good day. Bye-bye.
Bye-bye.